we're on Zoom here as well.
In my microbiology from SOLS, I'm joined by my colleague, Helen McGuire, Associate Professor from SOLS. Together, we coordinate meeting together. And I'm also joined by Andy from Math and Stats, coordinating Data 3888, and Mike Widjaja. Oh, thank you. Coordinating Bio 1007, Bio 1009 from SOLS as well. We are going to be sharing our experiences with implementing interactive orals in Year 1, Year 2, and Year 3. So we know that in the age of AI, it's very good at producing very polished product. So what that also means that this very polished product doesn't really tell us much about what the students know anymore. And so instead, we wanted to shift our focus into something that's more focusing on the process and not the product of learning. How did you come to this conclusion? What happens if the parameter changed? So we had this thought that we wanted to really know how the students come to their conclusion. And in doing this, we wanted to talk to every one of our students. And this will make sure that we actually know where the students are. But one thing, so what interactive oral assessment is a short, real-time, unscripted conversation where the assessor can actually probe what the students understand. You can ask, why do you think this way? How did you arrive at this conclusion? What if your assumption is wrong? What about another alternative algorithm that you might be able to consider? Now, this is all fine and good, but when it comes to implementing it, I think this is where most people will find very daunting. Of course, we would love to talk to every one of our students, but if you have hundreds of students in your cohort, how do you actually make it work? So that's why we're here today. We've all done this for the past year or two, and here are some of the trials and tribulations we would like to share with everyone. So I'm going to pass the time to everyone, so 20 seconds each. Mike and Andy and Helen, if you can quickly talk about your cohort and the format of your interactive orals.
All right, thank you, host. So so I run a first year unit along with Osu. It is mainly pharmacy students. We have about 320 students, and in this we have a open conversation, which is this interactive oral that we have with 5%. So it's a nice low stakes introduction to an oral assessment for the students.
Great. So now we're stepping it up to a second year subject where we have both microbiology and immunology that we're teaching. We've replaced a mid-semester exam, and it's very scenario based. So we're giving them scenarios, we're asking them questions they can prepare ahead of time, and then we throw in what if questions. So there's some questions curveballs they won't actually know. So that's our scenario in lane 2.
So now moving on into third year. So in our third year data science capstone unit with 520 students last semester, we ran an interactive oral assessment where students have to do a data analysis beforehand, and then they pitch their results in 3 minutes. And what we find is that students have a perfect, well-scripted pitch with beautiful presentation slides, but then we follow up with 7 minutes of questions, and we sort of role play as like a stakeholder. And we often catch students where you explain something, can you tell me what that actually means? Or you said you applied this model. How does that model work? And we find that's a really good way of assessing whether the students actually understand what they've presented or not.
Thank you. So you can see that this assessment can be implemented both in lane 1 and lane 2 from 5% to all the way to 25% as a capstone unit. Now we are going to talk about how people, the most often asked questions, because when we talk to people about our experiences, the number one question that comes up is, how do you actually make it work with a lot of students? So we're going to start with Andy because you have the most students. You've got 520 students and you assess all of them across 3 days. How does that work?
So it was a whole operation. So pretty much every student had a 15-minute booking slot. And then the actual conversation took over 10 minutes. So there was a bit of buffer to change between students. And so, we used office spaces in the Castle building. And we had 15 markers with a whole timetable so that...
So 15 markers and single rooms that you borrow from staffs.
Yeah, from my colleagues.
A lot of networking. Yep. And so we're going to shift to Mike because you're on the other end of the spectrum. You're actually assessing students over 10 weeks. How does that work?
Yep. So because ours is open and it's a 15-minute time slot, so it's something that students book through Zoom, and they use Calendly for that. But we also give them the option to book and have a chat in the labs for these 15 minutes about this oral assessment. And we've had a small handful of students do that, but majority do go through Zoom. But they have up to week 4 up until the week after week 13. So that's UVAC week to book in that oral assessment. So it's completely up on them. But we do send them a few reminders during the semester if they haven't booked anything in or if they haven't done one at all.
Thank you. And Helen and my unit is kind of in the middle, but we do have a very large room because we run 3 or 4 sessions all concurrently. So how does that work?
We love our timetable team. We have conversations with them at least 6 months in advance. We also love our assessors. So we do some intensive training so that everyone, this concurrent element, we can't be certainly not assessing all of these students ourselves. So we spend quite a bit of time training everyone so we're all on the same playing field with the rubric understanding.
Yeah, so planning is definitely a key, and securing venues nice and early is also very important. Now, the next question that everybody will be asking is how do you make it fair? Because this is what student cares about very much. And we do have before training assessment, assessor training before the assessment, and also during and after the assessment. So starting from Andy and Mike, because you do some training, how do you train your assessors?
So we hold a practice session beforehand, and we have quite a simplified rubric so that each rubric item is on like a ternary scale. So it's quite simple to mark.
Yeah, Mike?
Yeah. And yeah, so same thing. So a lot of benchmarking and just making sure that all the markers are aligned. And just we do the marking during the conversation. So we use an SRES with all the different buttons, and then that will relate to feedback straight to the student after the conversation.
Yeah, and Helen and I, we also use SRES, and we implement that. We pull that from pull the marks on each assessor against each student across different scenarios from SRES, and we do some live moderation as well. So
yeah, we also recording. So that's just a backup in case there is some discussion about marks.
So recording everything. Yeah. So we also we look at the SRES results every day to see if there's an assessor that was more lenient, some of them were more stricter. That gets fed back to the assessor. And then we also look at trending up and down across the course of 2 weeks. Are we giving students better marks or worse marks? So no students were advantaged or disadvantaged based on their timetabling scheduling. Now, what are the students' experience for it? So I understand that, Andy, you've done some pre and post interactive oral survey already. Could you tell us more about your finding?
So as a part of our Scholarship of Teaching and Learning grant, we did a survey 2 weeks before the assessment. So before any of them would have started preparing. And 1 week right afterwards. And we asked sort of students about their perceptions of it. It was interesting to see that their anxiety levels sort of fell from before and afterwards. So it wasn't as bad as they thought. But with confidence, we saw that there was actually a slight dip in confidence after the assessment, which I sort of interpret as like by questioning them and making them sort of verbalize understanding, they're sort of exposing gaps in their knowledge and making them aware of that.
Yeah, like, I don't realize I actually don't know enough. Yeah, and Mike, you're dealing with first-year students who probably come into this sort of assessment for the first time.
Yep.
How did they find it?
Yeah, so completely first-time experience for the students doing oral assessments. And so these are pharmacy students, so they will have a lot of oral assessments, clinical exams as they come into later in their degree. But I think that USS scores from Bio 1009, and I think it kind of summarizes the conversation, how the students felt about it. And overall, they did really well. So I'm really proud that they were able to kind of go through this and do these conversations.
Yeah, and Helen and I have plenty of conversation about this in tutorials and practicals. And
yeah, and we do know they're anxious. So we've actually recorded, we've been actors ourselves. I'm playing a student and I will give them examples. We put that video up for them to see on Canvas, just so they know what they're stepping into.
Yeah, so what I found is students always say that even towards the end of the semester, they will say, I still remember because I actually talked about this. So the knowledge retention was actually great. And did you guys actually have any student appeal for the marks? People not happy with what they got?
Yeah, I did have a few a few appeals, but luckily we recorded our conversations as
Yep.
well, so it was really easy to look back. And often students would appeal saying, "Actually, I said this," and then we can say, "No, no, you didn't."
Yeah. Yeah. Mike?
Didn't really have any appeals, but within this 15-minute time slot, we do have a bit of chance of just verbal feedback straight after the students had their conversations. And I think that's kind of helped with, I guess, the appeal and how students feel, how well they went.
Yeah, so I think our general understanding is that the students were really anxious leading up to it, but after that, they actually felt okay. They actually feel more positive towards this experience. So, last question for everyone. 5 minutes or 10 minutes is hardly enough to assess everything. So, how do you strategically ask questions that actually show you what the students are thinking? So, we've got one example each. Maybe we can start with Mike.
Yeah, sure. So again, because this is just an introduction oral assessment, we kind of let the students choose how what topics they want to talk about. And so we kind of give them a list of learning outcomes. And when they make that booking online, they tell us what learning outcomes they would like to cover. And pretty much we just kind of ask them a different approach. So you've told us this learning outcome this way. What would happen if a particular drug was part of that? Or how would you explain this to a different context and so on?
Yep. And for Mimi? Oh, sorry.
Yeah. Do you want to go, Angela?
Yeah, so we like to ask students questions that probe their understanding. So, say for example, we say, "Well, this is an infection that was previously thought as was a bacterial infection.
Yeah.
So, walk me through how immune response would work." But then we'll throw them a curveball and say, "Hey, this is actually a secondary infection that was a result of a primary viral infection. So can you now tell me how would the immune response? How would you hypothesize how would the immune responses work that actually lead to this secondary secondary bacterial infection?" So this actually probes students' real life and real time understanding and not just rote learning of the lecture content.
Yeah, and the students who do a good job of joining the dots and doing the compare and contrast get better marks.
Yes, definitely. And Andy.
Yeah, so in data, I think it comes down to having a very clear rubric as well. So the students knew that they were going to be assessed on their model building, model evaluation, and the interpretation of their results. So they knew they would be asked questions about that. And we had like a question bank that the markers will sort of follow on based on what the students presented.
Great, thank you. So to sum up, and I think interactive oral can be implemented across different year level. The students will feel anxious, but I feel like overall we have a really positive perception to it. Ourselves, I feel like we have pretty positive. It's daunting. It could be draining sometimes, but it's overall a very good experience because we do enjoy getting to know all of our students. I do also find that they are really more happy to talk to us after that experience. So we do have a lot of collective materials that we would like to share and experience that we like to share. So we really would love to chat about this any further if anyone's interested. Thank you.
Thanks, everyone. That was great. The way that you did that presentation together is amazing. Yeah. Do we have questions? And a microphone for Andy somewhere. Oh. Hang on.
So it takes quite a long time to run through all of those. What are your experiences with students who've gone through it, then telling their peers what to expect for the next one, and how do you plan or accommodate that?
Yeah, probably just Mike. Do you want to go? Because you're
Yeah, so we're talking about the students kind of collude with each other about what to expect. So actually we look at our assessment. Ours is 2 weeks, and we look at our assessment, and there's actually no trending up and down. So even if the students know, we actually release most of our question. And I feel like because the conversation itself is very dynamic, so you come prepare and talk about this question. We'll ask you, okay, so what if this, what if that? And you come prepare for this question, and then I'll go to a different topic. Say if the student know that I'm going to talk about pathogen number 1, I'll ask about pathogen number 2 or pathogen number 3. I think it's also, I guess, depends on the assessor. If I know a lot about the subject matter, I can really easily pivot and really understand. So if the students only focus on this, oh, that guy tell me that we are going to focus on pathogen number 1, and then they put all their eggs in the basket, come passage number 2, they're going to fail that. So I feel like because it's a dynamic conversation, it's really hard to rote learn it. Yeah. Yeah. Any other? Yeah. No. Oh, good. And yeah, actually, we were looking at our grade. If the students talk to each other about that, we'll see the grade is trending up. But actually, we're actually very steady and even trend down a little bit because I think we expect more of the students later on. So I don't feel that collusion is a big issue, especially with conversation based. Yeah.
All right. Thank you.